All right, good morning. Welcome to the Permanent Supportive Housing Training. So I'm sure everyone by now knows who we all are, but just as a reminder, I'm Jennifer Pereira. I'm the HMIS Program Manager. Maria, you want to introduce yourself?
Good morning, everyone. I'm Maria Vargas. I am the HMIS admin here at the Coalition.
And I'm Tucker Morgan, and I am the HMIS Data and Reporting Analyst here.
Okay. As a reminder, if you followed the Zoom link to log into this training, we will be able to record your attendance. If you're sitting in an office joining the training with someone else, please put your name and organization in the chat so that you can receive credit for attending. So you only need to do that if you did not follow your own unique Zoom link. Okay. Well, first up, we'll talk about the goals of this training. If you were in our rapid rehousing training we just held, the goals look very similar. We're going to just give you a quick training refresher on navigating the screen. We're also going to talk about creating a permanent supportive housing enrollment, the housing move-in date, case notes, providing services, assessments, and exit. Okay, so first is the navigation. So when you log into Clarity, this is the first screen you will see. It's the default screen. At some point, you and your agency managers may choose to change the screen to a dashboard, but for now, every single person will log in and they will see this screen. It's the search screen. Your initials will be here. If you were to click on them, that will bring you to your user account settings. Your name will be here and the organization for which you're entering data. This is very important. We learned in the last training that if you are someone who has multiple agencies available to you, you have to make sure that you are in the correct agency when you're entering data, or else not only will you be entering someone into a program that's not within your agency, but you also won't have services available to you. So this will only apply, everyone most often will only have one agency available to them. People who are working with CES, through CES, either for CES or they're trained in to do CES assessments, may have multiple agencies. So this is very similar to Service Point EDA. You have to make sure that you're in the correct agency. Other icons on your home screen will be your mailbox. This is the Clarity inbox and messaging system. We talked quite a bit about it when we were talking about public alerts and notes, the notes tab. Here's your launch pad, and then right here's your reports queue. So if you are someone who's running reports, when a report is ready, it will the number here will change, and you will know how many reports are ready for you to review. Additional parts of this first screen, this home screen, the search bar. This is where you would enter in the name of your client. You can also enter a few letters of the first and last name, and you will it will drop down and give you options. Here, over here on the right hand, sort of like a navigation panel, will show you the last 5 searches. Right. Once you select your client, this is the screen that you will be brought to. This is the client profile screen. The client's name will be here in very large letters. This will be the client profile. If you click here, this is client profile, all the demographics. All of you who worked in Service Point already are familiar with the elements of the client profile. I reminded folks in the rapid rehousing session earlier this morning that we heard from a lot of people that they were interested in making sure the Service Point or the HMIS number from Service Point was somehow attached to the record, and so we have been able to do that. So on the client profile, there will now be an alias where the service point HMIS client ID is. Tucker reminded us a couple of days ago that other elements are also in the alias. So if there's a client that's duplicated and we merge their records into one, the other ID, the one that was merged into this record, would also be there. So if you are working within the client profile for the alias field, you have to be sure, if you actually are physically entering in like an alias name, that you don't delete the other information contained on the element, on the alias rather. Also history, so this is system-wide history. Programs, this is where you would create an enrollment. You click on programs, all of the active programs the client's enrolled in and other available programs for your agency can be found here. This is client level notes. So this is notes that are shared throughout. All HMIS users will be able to access these notes. This is also where public alerts are created. So if you're a case manager for a permanent supportive housing project and you're collecting case notes when you meet with clients, this is not the place to put them. This is really for system-wide notes. Files, this is where system-wide files should be stored. Most of your files, if you're a case manager, should be stored in the program level. We're going to show you that next. These two tabs, contact and location, we've reviewed a couple different times, and those are also accessible throughout the entire HMIS system. There is an option when you enter in a new client, you can make that client private. If you do, it means that only the people in your agency will be able to view the elements of the client's record. But it is very infrequent, so I want to make sure people understand the notes and files located here on what we're calling the client level are for everyone from any agency who logs into our HMIS to access. So you should be, rule of thumb is you should be keeping all of your notes and files within your program level tab. Here is your program level tab. So once you click on from the client level, you click on programs, and that's where you'll be able to see all of the active programs that a client is enrolled in. And it brings you, once you click on the program you are choosing, or once you've completed the enrollment, these are the tabs, the program level tabs. So there's the enrollment, and this is where you actually create the enrollment and enter all the enrollment information in. This is the history. So this is the history within the enrollment of services services that were provided. You can click provide service. That's where you would create a new service that's provided. And we did just we'll go over that a little bit later today. Assessments. So that's where you could complete status assessments or annual assessments or other assessments like the COVID-19 screening. This right here is where you, as a case manager, want to save any of your notes or files. So this is only visible by people in your agency, and specifically, you would want only people from your program to actually be going in and looking at them. But these are only visible by your agency. All right. Do we have any questions so far? No. All right, that's good because that's a refresher. So that's a good sign. All right, next up, enrolling a client into a program. Maria's going to take us through the enrollment.
Yes, so in Jen's previous screen, that image was a little bit cut off, but this is, yep, thank you. So this is when you're in this program screen, the rest of that screen, if we go to the current slide, is what's going to be popping up. So this is the programs available within your agency. So unlike Service Point, you won't be able to see any ended programs, any inactive programs. The only thing that you'll be able to see is your available programs that you can enter in your current clients in. So that second arrow, when you hit that caret, it expands the details for the program that you want to enroll your client in. So it can give you the description and availability within that active program. And that third arrow will show you any other household members, any family members that you want to enroll within that same program. So what you want to do is you want to toggle on that little blue circle next to the rest of the family to include them in that enrollment. So when you click that box, that red enroll box that's there, it'll bring you over to your enrollment screen. Thank you. So again, you guys have seen this before. It's your project start date. You want to enroll your clients, and the housing move-in date we're going to cover later on in this training, but very important. And the prior living situation. So these questions, again, you guys have seen them before, but if you're entering them in a COC funded project, the living situation and the disability for the head of household should be reflecting that chronic homeless status at the time that you enroll your client into your project. So we're talking about the project start date, having these questions answered to reflect that chronic homeless status. So if we go to the next screen, it'll show you the rest of that assessment for your program. Okay, but so you just want to make sure that you complete it for not just the head of household, but also for each household member that you've toggled on into that client enrollment. Go ahead, it's okay. This one's yours anyways, so take it away, Jen.
We're having significant mouse issues. I'm sorry. Sorry, Maria. Okay, so while you're in the middle of the enrollment, excuse me, you'll have to toggle on, answer all of the questions, the HUD elements. So the first is disabling conditions. You would, in order to either create an answer or change an existing answer, you would click on this little down arrow, and these are your options. These look the same as if they don't look the same. They are the same as if we were in Service Point, they just look different. So just once you answer all the disabling conditions and barriers, you continue scrolling down and you get the monthly income and sources. So this is a little different here that you use this little button to toggle on. If you answer income from any source, yes, then all of these will appear and you will toggle on any that are applicable, and then you will enter in the amount. As you continue scrolling, and we don't have a slide that shows it, you will have non-cash benefits will be the next section. Same thing, if you say yes, all the non-cash benefits will appear and you will use these to toggle on any that are applicable. The one difference with the non-cash benefits is you don't have to enter the amount. And then the final area is the medical insurance. Same thing. If they have medical insurance, you click yes, all of the options will pop down, or will pop up, I should say. Excuse me, and you will toggle on any of the medical insurance options that are applicable. Excuse me. Okay, so group enrollment, when you created the enrollment, if you associated any household members or into the group, as Maria has shown us earlier, then once you complete the enrollment for the head of household, Clarity will present all additional household members that were associated with the enrollment. Clarity will present the enrollment for each of them. So you will need to complete the enrollment data, for all of the household members. All right, next up, housing move-in date. We did talk about this at the rapid rehousing training earlier this morning, so apologies for any duplication, but we do have some new folks joining us for this session. So I'm going to scroll back. So when you complete the enrollment for the head of household, or actually for any household member, but the head of household is most important, you would complete the housing move-in date for your permanent supportive housing project. So that should be the project start date. It cannot be, and I'm going to scroll back to the housing move-in date slide. It's the sole element that determines if a client in a permanent supportive housing project is housed. In order to do so, that move-in date must be recorded in the project entry screen. I just showed you that. If a client spends time in a housing search, which typically for permanent supportive housing, that's not true. For rapid rehousing, it is. Goodness. The only other thing I just said was that the move-in date must be on or after the project start date. But for permanent supportive housing, it most often is the exact same date that they move in to your permanent supportive housing project. And then lastly, you can only have one housing move-in date per enrollment. If a client relocates, they keep their original housing move-in date until they return to homelessness. Which hopefully they don't. And it says, unless they return to homelessness during their housing search, in which case they must be exited and re-enrolled with a new housing move-in date. But again, for permanent supportive housing, the goal is that they move in, have one move-in date, and they remain stable. Any questions or anything, Tucker, Maria, that I missed about the housing move-in date?
Not that you missed, but I think people should be aware that the way a lot of folks have been recording the housing move-in date only in an interim in service point. So when they look at so if you think that might be the case, I would really recommend that you go through each of your clients and check their enrollment screen as soon as we move over to Clarity. Because it's likely that the housing move-in date is missing because it was never recorded on a project entry in service point. The other thing is that you want to be careful because I think some folks have been putting interims with new housing move-in dates when clients relocated. And if you only use the time that they moved into this latest housing situation, it will show up on your APR as if they spent, 3 years homeless while they were in the project before they moved into housing. And I don't think that's going to be the case for any of your projects. So you want to make sure that you're going in and seeing when their original move-in date was and updating it on their project entry screen. And that's going to be true for a lot of your rental assistance projects in particular, that you're going to have to go back and update it as soon as we get into Clarity.
Okay. Thanks, Tucker. I'm actually starting to keep track of a little, like what to do when we go live, little reminders that we might want to send out to folks, and checking the housing move-in date is then added to the list of reminders. Thank you. All right, so the next slide is actually questions. Does anyone have questions about creating the enrollment, any of the enrollment elements, the housing move-in date? This is really your opportunity for us to show you or to answer any questions. All right. If we don't have any questions, we'll keep going. If you think of a question, feel free to unmute yourself or put it in the chat and we'll answer it. Next up, Tucker is going to talk about program case notes.
Yep. So in permanent supportive housing programs, you can record services or notes. I would recommend primarily recording notes. And the notes, you really want to make sure you're within the program because those are the private place that they will not be visible to anybody outside your agency. And people within your agency, they'd still have to print a notes report or go into the program to read them. So they're not very, very visible publicly in general. So if you go to the notes tab, you'll see the history notes, you'll see the title and any notes that have been recorded, and you can click Add Note to add a new one. So this is what the note screen looks like. Notes have time tracking enabled, so so that you can review, so that managers can review how long staff are recording spent with their clients and in their case notes. And the other point is that both there can be case management services recorded or case notes, and you want to make sure that your agency has clear policies that so that case managers are single counting their time and are not having to write notes twice, because the notes report and the service notes report are two different reports for printing it out, so it's a little easier to keep things generally in one place. We also recommend that you only use initials or CLT instead of a client name as a measure of security for if you are going to print out those notes to put in a file, that they can't be sitting accidentally on a printer. And if a client does ultimately remove their consent, we don't want to have to, for entering their information into HMIS altogether. Let's say they get really mad at you guys because something goes wrong with their housing, then we don't want to have to go in and make changes to the notes to de-identify them at the end. I have had that happen where clients have gotten so mad that they've insisted on removing their information from HMIS. So that's
it's also just best practice as well. Like if you're an agency who's ever gone through any sort of accreditation, client notes not containing names and identifying information is one of the best practices. Thanks, Stephanie. Sorry.
Yep. So that's how you would record notes. You can also record services from the Provide Services screen in the program file. The only service that's available by default is case management. So if there are additional services that you want to keep, if there are any services that you want to keep track of, then you should contact the help desk to configure those on a case-by-case basis. And you're not required to double record both a case management service and a case note in the system, because again, each of those places is keeping track of their own time and note independently of each other.
So I would recommend, if you're someone who's a program manager or agency administrator and you're updating any of your policies and procedures surrounding record keeping, particularly related to time and effort. So one of the big things for both our ESG and CHF funds, but also particularly our COC funds, time and effort. So in order for your agencies to bill or draw down funding, you need to be able to make this, they need to be able to track every dollar spent, every hour billed to a direct note that explains where you spent your time and what you were doing. So there's your time and your effort. So the service, providing service, the note for providing service actually accomplishes that. So you might want to, once you get into Clarity Live, take a look at it and alter your agency's policies and procedures to best capture time and effort and make your life easier. So that's our plug for time and effort. Sorry.
Yeah.
Okay.
Exactly. We can also configure if you are want to track Medicare home health, Medicaid stabilization, excuse me. We can configure a specific funding source that's associated with the case management service so that you can track if you have stabilization funds for your permanent supportive housing clients, that you can track them using a funding source on the service for the purposes of billing.
Okay, let's see. Next up, Maria's gonna, wait, isn't Maria talking about No,
Oh,
sorry.
assessment.
Parker's going to talk about program assessments. Sorry.
Yep. So assessments are in the assessments tab, and the status assessment replaces the interim assessment, which was in Service Point. Status assessments are not required of PSH projects in any way, shape, or form. The APR will only pull information off of the annual assessment. So the APR is only going to use the entry information, the annual assessment information, and the exit information. And if you are the assigned staff, you will see that there will be annual assessment due warnings that will pop up on your caseload, and when you go to the client profile, you'll also see that annual assessment due will be visible, and you can click right from there and create that annual assessment. If there are other assessments that can be configured on the assessments page, like the COVID screening tool, and if you have any custom assessments that you use for housing stabilization, then we can also configure those. Yep, so we have to decide where the full SPDAT will be, but it would be an assessment.
Yeah, we're just waiting for some clarification around the full SPDAT and the requirements. So we'll be adding that as soon as we receive the clarification. All right, any questions before we move on to exit? I did add in the chat the annual assessment that Tucker was referring to, and we're just going to scroll back. You're able to complete the annual assessment, and my first chat had an error. So it's 30 days before the annual date, up to 30 days after. That's the range in which you can complete the annual assessment. All right, Maria's going to talk to us about exit.
Exits. So this is you're still in your program. Under the history tab within your program, you're able to exit out your clients once they leave the program. So as you can see, all you got to do is go to your to the right of the screen where that arrow is pointing, and that's where you click that exit. So it's the same questions as you would before. You want to make sure that if it's a group enrollment, if it's a family, a household, that you're exiting every single person from within that household from that program. So again, all you got to do is just toggle those screens on that bottom piece of the screen. Yep. So all you got to do is make sure that you click every single one, and it's going to bring you to the exit screens for each of them. So you got to do the household, the head of household, and then the rest of the program, the people enrolled within the program as well. We can go to the next screen if you guys have any questions.
As a reminder, we did in the rapid rehousing training get some questions about adding members to a household after the enrollment's completed and exiting them. And so if you were exiting one member of the household, you would still click exit. But what you would do is toggle off any of the members that would remain in the enrollment. So in this scenario, if the wife is leaving this household or no longer going to be living in this permanent supportive housing, or enrolled rather in this permanent supportive housing project, you would toggle off seasoned fries and sweet fries and just leave curly fry to complete her exit only. That would exit her from the enrollment. And the process for entering someone in when you're, and I'm going to scroll super far up to the beginning here. Let me see if I can sort of make you all dizzy. When you create a profile, if you're adding someone to a household already in HMIS, then you just use the search feature. But if you're adding if you search for someone who you're adding to a household and they're not there, the first step is to add their profile. And we covered that during the profile training. Once you get to the point where you're adding the enrollment, let me back up. Once you're in the head of households profile, you actually want to manage household members, and there's an add button. So you have to add any members to the household before you proceed to the enrollment screen here. So in order to get these group members as an option to add, you need to have them added to the group first. So if you have a household where you're adding one new member, like a baby, for instance, you would create the client profile, search for the client, which probably won't be there for the baby, create the profile for the baby, add the baby to the group, which is very easy to do, and then you would toggle to the active enrollment, and you can add a household member to the enrollment. And then you would follow the same for the exit. Chelsea DePaul is asking, is the annual assessment date 1 year after you completed the entry assessment? Correct. So the annual assessment is completed 1 year after the entry and every year thereafter. So if someone's in a permanent supportive housing project for 3 or 4 years, you would conduct the annual assessment within the 30-day range of that annual assessment each year. That's a great question. Any other questions? We did reach the end of our slides here, so we just want to hear from folks. Is there anything you'd like us to show you on our training site? Any other questions? No.
Jen, I have a private one. When you're doing an annual assessment, is it just a snapshot? Are you able to make the changes on the annual assessment, or would you have to do an update first?
Let me, I'm gonna switch over to another agency here. Sorry. Give me 1 second. So I want to get to an enrollment that we have. Okay, so I just made myself a user of Crossroads, Rhode Island. I selected Tessie Tester, who we know has a lot of active programs. That's why I toggled over here. I'm gonna select this rapid rehousing program here. Okay, so I am in the program level. So if you recall from the training refresher, this is the client level. I selected an enrollment that's already active. So I'm now in the program level. So what you would do is click here over to assessment, and you would create an annual assessment. You would start an annual assessment for a Tessie Tester. So of course the dates aren't accurate because Tessie Tester, just as did everyone in our training site, just got added. So the annual assessment option looks a little funky here, but what you would do is the status date is the date you're conducting the annual assessment, and all of the information here for disabling conditions, monthly income sources, it looks filled out now. But when you go to do an annual assessment, if those elements have not been filled out recently within the system, then those will ask you to create answers for them new. So the reason why this annual assessment has all of the assessment questions already answered is because it hasn't been a full year. So this information has been newly entered into our system. So what you would be, whoever asked the private question there, would be answering, make the project status date is the date you click to add an annual assessment, you would answer any of these questions for disability. You would answer if they have monthly income, yes or no, or client doesn't know, client refused, data not collected, but hopefully it's a yes or no. If it's yes, all of these will cascade down. You'll use the, just click right on to toggle an income source on or off. If you toggle the income source on, like we pointed out earlier, the amount will come up. Additional elements of the annual assessment include the non-cash benefit. So if you click no, the elements that the options, the choices for non-cash benefits won't show up. If you click yes, they will show up and you'll simply toggle the applicable benefits on or off. Same for health insurance. And then that's it. So there's a reminder, enter the housing move-in date on the enrollment screen when a client was in the permanent housing. So just as a friendly reminder. So you would save the annual assessment and close it. If you needed to edit that assessment, you made an error, you would, again, I'm just going to show you here. Down here under the assessment history, any assessments that have been completed for that client would be here. You would simply click on the edit pencil and you'd be able to edit any of the elements. I hope that answered question.
Yeah, and one quick reminder is just that, you know, for permanent supportive housing programs, you really should make sure that you have accurate information on income at start and on their latest annual assessment. So if, and one thing that can be slightly tricky is if a client is receiving the state supplemental Social Security, you want to make sure that that wasn't listed, that if that was listed on the entry, that it's also listed on all of the annual assessments, because otherwise it'll look like your client's income went down, and you don't want your, and client's income should not be going down, especially if they're on fixed income during their participation in your housing project.
Oftentimes, the permanent supportive housing programs have one person who's, you know, like a housing manager or in the finance department that's conducting the rent certifications, but it's not a bad idea to have something set up where when the rent research are happening and the income documentation is submitted, there's some kind of communication so that the case manager who's completing this annual assessment actually has access to whatever documents were used for the rent certification. That's the easiest way to make sure to verify with your client, oh, you know, you provided that you have this new income for the rent certification, so that you can go ahead and make sure that records sort of match. Any other questions? All right. As a reminder, if you are someone who's still having trouble logging into our training site, there was an email sent out this morning with instructions. So we will be able to, if you still can't log into the training site, you can send an email to our help desk with the subject word password, and we'll be able to issue you a temporary password. Any other questions before we wrap up, or wrap it up a little bit early? Okay, as a reminder, when we go live next week, our help desk will feature a live chat option. You also can just send an email to our help desk by emailing this email, hmis@rihomeless.org. As a request, please do not text our personal cell phones or email our Jennifer, Tucker, or Maria at RI-HMIS.org emails, anything related to this migration. If you email our Jennifer at RI-HMIS.org email, or Tucker, Maria have one as well, then the other members of the help desk won't be able to view that. So if you truly need help, the one thing to do is to send one ticket to HMIS@RI-HMIS.org. All three of us can log in, see those tickets that have come in or emails that have come in, and we can triage and answer them. So you do not need to send a second or CC or BCC any of us on help desk tickets, because we all have access to the help desk. We can see all the tickets that are coming in. We're just receiving a large volume of tickets right now, and we just want to answer everybody as quickly as we can. If we have duplicate and triplicate emails, it's just more time that we're taking to try to get through all of our tickets and all of our email desks, or email inboxes rather. The help desk is set up so that once you submit a ticket, unless one of us physically marks it as solved or closed, it is open. So you do not need to submit another ticket an hour later or 15 minutes later. One ticket and we'll troubleshoot it. Sometimes we have to talk to our vendor, so that may take a little bit of time before we solve it, but it does stay open until we click it and mark it solved or completed, or closed rather. So you don't have to repeat send in the same request over and over. Any questions about the help desk before we wrap up? No? Everyone's very quiet. Well, this actually concludes all of the Clarity data migration trainings that the HMIS team has put together. We do have 2 additional trainings scheduled, which are next week on Wednesday and Thursday. They're in our Eventbrite, and they are called Getting Started. So it's 1 hour each day. The 14th is the day that we anticipate we're going to be going live. So if there's anyone who's just having trouble sort of logging in or navigating to where they need to be, we have that time. You can enroll to get help. You can enroll up to the minute before actual Getting Started session starts. Unlike these trainings where you couldn't enroll after 24 hours before it started, these Getting Started sessions are intended for people to just pop in and get whatever help they need. So we have those 2 scheduled, and we'll have more training scheduled in the days and weeks to come. Let's see what's happening in the chat. Oh, Ashley says, what? Thank you, HRIS. She can't wait for the transfer. We can't either. I know that learning something new is, you know, taxing on your brain when you're already so busy with everything else you have to do in your day. But this system, once you get acclimated to it, is going to make your life so much easier. Trust me, it will. Tristel is saying, is there a way to track income deductions? For example, Social Security, Medicare deductions. At times, clients enter the program with a higher amount of income, but then it's lower due to certain deductions and appears like they're not making progress in the program. That's a good question.
So, Crystal, the way that should be is that what you enter into HMIS should not be the amount that they finally receive from Social Security, because they're receiving that Medicare for the premium that they're paying for it. So especially if you are getting the documentation that goes along with their recertification, right? You should have the full amount of their Social Security before that Medicare premium is taken out, and that's what you should enter into HMIS. It's a good question, though. It's a fantastic question. That's the specific.
Yeah.
And I'm saying yes. Don't, and that's what I was telling you. Don't forget the state supplement for Social Security for folks who are receiving it.
Yep. Thanks, Adam. That's important. Any other questions or reminders? Anything that we should make sure to share out with users the day we go live? We are going to share out to remind people for rapid rehousing and permanent supportive housing projects to check their move-in date. As a reminder, the data that we started moving yesterday over to Clarity is going to go through some transformation. So for an example, if if someone data entered a family in and there were head of household, there were 2 head of households or no heads of households, as the data is moving, Clarity team and the HMIS team determined how data would be fixed or transformed. So when the data lands in Clarity, there will only be 1 head of household. So if there were 2 heads of households identified, the oldest member in the group will be labeled as the head of household. That may be something you want to go in and change, but for the overall good of the head of household data, that's what we chose. If there were no heads of household chosen, then we, again, defaulted to the oldest member. So there are a number of those data transformations. We won't get into all of them, but we will provide our agency managers with a little short list of what transformations happened. If you see something that's funky with your data, reach out to your agency managers. And again, we're going to have a lot of trainings, getting started trainings in the weeks after we go live. So if there's something that you're struggling to resolve and you can't resolve it with your agency manager, you go into the Bit Focus Guide articles and those don't help you either. Join one of our Getting Started sessions so we can answer those questions, or you can submit a ticket to the help desk. So there's lots of options. You're not going to be sort of out there with your data on your own.
The other thing that will happen in the migration is that some of you might have in Service Point been switching a lot between EDAs because you had 2 or 3 different, say, Grant 31 rental assistance bins. When you're in Clarity, you'll see that those have all been collapsed, so you won't have to do that anymore. Everybody who's received under that particular grant will only be in 1 project. And you won't have to switch between EDA bins within your program at all anyway. So it should be easier for you.
I actually just received a message from our vendor that the training site password bug that was affecting some of us was fixed. So if you're having trouble, try to log in one more time. It should be resolved now. If you still have trouble, go ahead and email the help desk, but it should be resolved now. And again, apologies. When we're working on a project of this magnitude, there are bound to be things here and there that we're going to have to identify and resolve, and that'll be the process going forward. We're just going to work hard to communicate with all of you so you're aware. All right, any other questions? It doesn't have to be just around permanent supportive housing. Any questions at all that anyone has around logging in, training, any of the trainings that we've held to date? This is your chance before we end the meeting. Okay, well, everybody take care. You'll be receiving communications from us around upcoming training offerings, and also check your email as we get ready to go live. We'll be emailing out everybody with the specific confirmed date and time. Right now it's scheduled for the 14th, which is Wednesday at 9 a.m., but you know, everything is in motion. So we will confirm that in an email to you, and also at that point we'll be providing you with a link to the live site and the password information, how to log in. So that will be the next things that you, Alex says password's working. Yay, thanks for testing it, Alex. The next 2 things you're going to get from the HMIS team are additional training offerings and hopefully our go live communication, giving you all the details about the live site. So we're excited. We hope everyone has a really great rest of the week and a restful long weekend, and we'll see you guys next week. Take care.
Bye, everybody.
Bye-bye.